Hi, Jesse. This is Christine Cheng with Care Message.
Hi, Christine. Good morning.
Good morning. It looks like we are waiting for participants to join. It's just myself, two others from Care Message, and you on the line currently.
Yes, and Nancy just ran into a similar thing that I did, that she did not get a message after registering.
That's odd. I'll stop sharing my screen momentarily to see if we can determine what's happening.
Okay.
Jesse, this is Christine again. We're not sure why Zoom didn't send out that link, but we are emailing all registrants right now with a universal access link so that they can dial in.
Very good. I will continue to just stand by then, Christine, and appreciate your help getting folks in. And then, am I just voice only today?
Yes.
Very good. Okay. Well, then maybe just give me a note by chat box when you're ready for me to start the short introduction, and we'll go from there.
Great. Let's see if we can get some participants in, and then I will give you a verbal cue because I'm sharing my screen.
Okay, that's great. Thank you.
Of course. Apologies for the delay here. Good morning, everyone. My name is Christine Chang, and I am the Strategic Partnerships Manager here at CareMessage. I want to begin by apologizing for the complications with Zoom and this platform, and want to thank everyone for bearing with the login. I see about 15 or 16 participants, so given some of the complications, we can wait maybe another minute or so, and then I know Jesse from the Alaska Primary Care Association will open up with some remarks to start today's webinar. Let's go ahead and get started.
Right. Good morning, everyone. This is Jessie Menkins with the Alaska Primary Care Association. I'm the Safety Net Initiatives Program Manager for the association. And we're really pleased to be able to have CareMessage with us today. And Christine Chang will be taking us all through a demonstration of a program that we feel could be very beneficial to you and to health centers across the state. Given COVID-19, as we all know, so much has changed so rapidly, and business as usual in regards to outreach and those efforts to connect with members in your community and connect with patients, a lot has changed. The old ways of thinking that we could go out to a park and do outreach at a local event, navigating work at a food bank, all of those previous modes of outreach at this point in time are not viable. And so it's really, really important that we shift gears however possible and look to new tools and new opportunities to reach out to those who are underserved and those patients that you've been working with in the past, as well as new patients, those individuals who might have just recently lost their jobs, who maybe have never been faced with the prospect of being uninsured or underinsured. And certainly we're all cognizant of the needs of various other safety net programs right now. So without further ado, I would like to turn things over to Christine with CareMessage. Thanks so much, Christine.
Thank you, Jesse, for the warm introduction, and thank you to the Alaska Primary Care Association for making this time available. For today's webinar, the goal will be to share and introduce you all to CareMessage, who we are as a nonprofit organization and healthcare technology organization, as well as our free COVID-19 texting solution. As Jesse mentioned, we will go through a very brief product demonstration, and wanted to encourage folks on the line to submit your questions via the Q&A feature on Zoom or to comment in the chat box. My contact information is there on the right, and for Alaska Health Centers, we have a primary point of contact here at CareMessage, who is Blair Lynham. He's on the line today and will follow up with folks who are interested, and please feel free to reach out to him if you have any additional questions. Very briefly, wanted to touch upon CareMessage and who we are as a 501c3 nonprofit. We build messaging technology for underserved populations, specifically partnering with federally qualified health centers and free and charitable clinics. We're pleased to also work with the different supporting organizations such as primary care associations, health-centered control networks, as well as other technologies that serve safety net organizations such as Azara and IDOI for population health management. We were founded in 2012, and our focus has always been on underserved communities and specifically understanding the challenges that safety net providers face when supporting and delivering care to underserved communities, specifically communities of color. We currently work with 300 safety net organizations across the U.S., We have one partner, and we are proud to have one partner in Alaska, that's Matsu, and are eager to work with all of you as well. Since March 2020, our organizations have sent over 10 million COVID-19 related messages to their patient communities, and that's a number that grows every day and every week. We'll talk more about how exactly these health centers are reaching their patients, the types of messages that we provide and that they can customize to send out, and the actual technology to do so. Very briefly, I want to mention Project Equity, which is an initiative that our organization launched at the end of March, specifically to disseminate our free texting solution to health centers that serve communities of color. Our focus has been on identifying identifying safety net providers that work with communities of color who have experienced the greatest disproportionate impact of COVID-19. Those communities include Black and African American patient communities, Latinx communities, as well as Native American and Alaska Native communities. And so today's focus, of course, is for Alaska Primary Care Association members and your patients. Our CMLight platform focuses on two functionalities based off of what we heard from our partners as being most crucial in being able to reach their patients during a time of emergency. The first type of message that you can send with CMLight is group outreach, which is the ability to send a single message out to hundreds or thousands of patients. Those topics and the use cases for COVID-19 are outlined on the next slide, but include anything from social distancing best practices, hand hygiene, clinic closures, as well as mental health and behavioral health support hotlines that we've seen some of our health center partners set up in response to COVID-19 and wanting to offer their patient communities a direct line of access to receiving help. We've also seen our partners message and send out local resources and links and connect patients with resources in their community, whether it relates to food, housing, transportation, during this really important time. And last is telehealth. So knowing that many health centers in Alaska are using some form of telehealth or perhaps thinking about adopting telehealth, Care Message created tutorial videos that health centers can send to their patients to ease the transition from typically going into a clinic and to being able to adapt to new telehealth technology, which we know is a really important and critical functionality for health centers in Alaska to be able to ease the transition or support the transition your organization has already made to providing virtual services. All of our content is written at a 6th grade reading level or below. You have the ability to personalize any message you send in Care Message, and we created a COVID-19 specific library with over 60 messages, and we update this on a weekly and bi-weekly basis based off of what our health center partners tell us that they need to communicate to their patient communities. And we do offer all of our content in English and culturally relevant Spanish translations. I do want to acknowledge that I can imagine for the health centers on the line today that there may be other languages that are really important to send messages to. And as of right now, Care Message only officially supports English and Spanish, and that's because we do all of the translation in-house. We actually have a part-time Spanish translator with a certificate in doing health and medical translation specifically, and for that reason, we officially only support English and Spanish. However, it is possible to send out messages in other characters and other languages, though you will want to and will need to receive bidirectional responses from your patients via English or Spanish. Most importantly, the ability to send out outreach messages, as well as the ability to do the one-to-one patient follow-up via direct messenger, has been made completely free to safety net providers in the U.S. For 60 days. And this is made possible by generous philanthropic support from our donors. And there's no long-term commitment or obligation for health centers to purchase Care Message after the 60 days. I want to talk a little bit about some of the use cases for outreach specifically and CMLight. We made mention of a few different topics that are included in our message library on the previous slide, but the development of how you can use outreach and the way that we've seen our health center partners begin to message their patient population has focused on these topics you see here, whether it's preventing spread, offering testing information, care coordination via one-to-one messaging, connection to resources, and chronic disease management through this time. And though, obviously there's no treatment or vaccination for COVID-19 today, we do understand that health centers play a critical role as a source of trusted information for patient communities. And with so much information available in the mainstream media and on different websites and different sources, we know that health centers, specifically FQHCs and tribal-run clinics, play an important role in being a trusted source of information to address topics that are developing, such as addressing treatment and vaccination. Messaging and connecting and sending resources to your patients don't just stop at a single message. On the examples that you see here on the right, we offer different ways to continue connecting with your patients, whether it's prompting them to call in if they need specific help or assistance, being able to send out URLs and links on resources that you find to be valuable, as well as, of course, the ability to receive responses from your patients via bidirectional response. And these are actual examples that we've seen our health center partners use. Many of the organizations that we work with are implementing telehealth solutions for the first time. So I wanted to share one example here of how you can use bidirectional and multiple choice responses to better understand what resources and what technology your patients have within their household. This is just one example, and again, I understand that it's very possible that your organizations have adopted telehealth already, but as a really great example, one that's relevant for many of our partners today is understanding and sending out a survey of a single question to your patients, asking what technology do you have in the household for a virtual visit, and then being able to provide subsequent resources based off of that response. With that, I'd love to go into the product demonstration to show you how exactly CMLight works. And we'll begin by logging into CareMessage. What we're looking at right here is the homepage in CareMessage. And of course, on the left-hand side, you see all the functionality that I've mentioned thus far to be able to get messages out to your patient population. The first thing you'll want to do is upload a list of patients. So using a file export, whether it's from your population health management solution or from the EMR, you'll want to use CareMessage's file center to upload that patient list into the platform. And then from there, you have the ability to actually create cohorts or groups of patients based off of the list and based off of the file. This will allow you to send targeted messages and relevant messages to sub-cohorts and smaller groups of patients based off of perhaps the different parameters in which you pulled that original list. I'll navigate over to Outreach, where you can see all the different messages that you can send out to your patient population. And I've created a few examples to show you how our health centers are currently using CMLight today, whether it's sending out the telehealth preferences survey and being able to look at who are the 19 patients I sent this to, what are the responses, is there any follow-up I would want to do individually, and being able to understand what's the best way to get in touch with these patients for virtual care, as well as the ability to look at active or scheduled messages that might come up later today. We'll click into a specific outreach message, and you can take a look that getting a message out is as simple as selecting the patients who you want to receive this message, perhaps based off of the group that you created via file upload, and then using a template to select a message. So in this case, I already pre-populated a face mask information template. I can go ahead and name this particular campaign. And if there's any customization required, I can, of course, edit the template, or I can leave as is. I also have the ability to craft original content on my own if I wish to, and I'll schedule the date and time for sending out that message. Upon clicking save, you'll see exactly what you saw earlier, which is that that message is now scheduled to go out. In addition to having the ability to reach hundreds or thousands of patients, you have the ability to do one-to-one follow-up. So in this case, you can take a look and see, and based off of perhaps asking a question such as, do you need to hear from someone at the health center, or if patients raise their hand or reply back saying yes, they need support, you can send a one-to-one direct message to patients. In the interest of time and being very conscious of just having 8 minutes left, I'll conclude the demo here, but of course want to encourage everyone to learn more about CareMessage by getting in touch with us, and we're happy to share more about the CMLight workflow as well. It's worth mentioning very briefly before we go into the Q&A that getting started with CareMessage again is very simple. You can, of course, reach out to us and learn more on our website, or get in touch with myself or Blair after this webinar, in which you can not only learn about CMLight, but if it is of interest, learn more about our larger full-scale platform, as well as how exactly we will integrate with an EHR or population health management solution, in addition to what you saw as the standalone solution with CMLight. With that, I will conclude the presentation and open up for questions.
Christine, I do believe we lost you on audio.
Just now or earlier?
You're back now. That's great. Christine, we do not have audio at this time.
Thanks, Jesse. I'm currently not speaking, just giving folks some time to think of questions that they might want to submit. It looks like we have one question, and I'll go ahead and open that up. Great, and the question reads from Roxanne. I might have missed this in the beginning, but do you see this largely as a platform for logistics management with patients, or is it built to capture clinical information as well? What about creating dialogue for e-visits? This is a great question, Dr. Richards, and to address it in each part, we see health centers using CareMessage for all of those use cases. In a pre-COVID environment, we often saw the main use cases for CareMessage being improving no-show rates through bidirectional appointment reminders, as well as a focus on quality measure improvement. And certainly in post-COVID or during the COVID-19 emergency, we've seen an increase in the use cases for logistics management and care coordination and coordination to local resources, But absolutely, it is possible to capture clinical information and self-reported measures from your patient population, which was a very common use case that we've seen with the outreach messaging specifically. For creating dialogue with e-visits, this is absolutely one of the use cases that we've seen. So the ability to send out information about the different telehealth technology that you're using, letting patients know you should receive to expect a unique phone number or a link from us, or please log into your patient portal to create that continuity and ensure that patients understand how exactly to access their e-visit. And great, I do see the comment here that Blair just responded to in the chat.
That's right. This is Blair, everybody. Thanks for participating. If you're interested in any more information, I'm happy to connect with you. Two ways. You can either email me directly. I'll put my email address in the chat, or if you go to the link that Jessica Day posted, there's a quick form to just fill out, and I'll reach out, and I'd be happy to connect individually and talk more about some of your own maybe unique use cases as well, and get you set up on the platform.
Thanks for that addition, Blair. And last but not least, we'll send out this presentation deck and recording later today. With that, I want to thank everyone for making the time to learn about CMLight. We are incredibly honored and grateful to have your time during what I'm sure is an incredibly busy time for everyone within the safety net, whether you're at an FQHC or with the PCA. So thank you everyone again for the time, and we look forward to working with you.
Thank you so much, Christine and Blair. We really appreciate having you with us. And we will look forward to next steps and seeing how best to support FQHCs across the state. Thank you.
Thank you. Bye, everyone.